The scalp itself is the area of skin that extends from our frontal hairline right to the nape of our neck and in between our two ears. The word scalp is actually an acronym. So S standing for skin right at the top, and C is connective tissue, which sits just under the skin, all the way down to our skull or the periosteum, which is the P. So the scalp can be thought of as the garden bed and the hair itself as the plants growing in that garden bed. An unhealthy scalp may present with symptoms such as itch, redness, flakiness is a really common symptom. There may be overgrowth of bacteria, yeasts, and in some cases there can even be viruses that affect the scalp, such as shingles. And this can adversely affect the hair follicles from which the hair grow. So if there's a great degree of inflammation, they may be directly scratching their scalp, which can then adversely affect the growth of hairs. The hairs can break off or they may fall out more easily. It's a really common question I get asked: how many times should I wash my hair? Or does overwashing cause me to lose more hair? And it really differs from person to person and from culture to culture. Often people who undertake a lot of sport or exercise might find that their scalp is more oily, affected by sweat. In general terms, men tend to have slightly thicker skin than women, and the same applies to the scalp. So you'll often find that men's scalp are not only thicker, but also have a higher density of oil glands. This means that their hair might be a bit more oily than women's, and it also means that they might be prone to other conditions of the oil glands, such as acne. Some of the really common conditions I see as a dermatologist include seborrheic dermatitis, which is the technical name for dandruff. Psoriasis is another common condition of the scalp. And of course, the broad range of conditions that we call the alopecias, which can include androgenetic alopecia, or male or female pattern hair loss, and alopecia areata. I think a really important tip is not to be spending terrible amounts of money on trying to optimise scalp health or hair care. Hairdressers are actually a great resource as well, because they see not only many different types of scalps and hairs, but they generally know your scalp itself. I always encourage patients to seek professional advice from their general practitioner or a specialist dermatologist if they have concerns about their scalp or their hair. And I often find that, patients who don't overdo things find that their scalp and hair are happier for it.